think 1 minute and we will start, inshallah. Good evening, everyone from the United Arab Emirates. Good morning, good day, good afternoon to everyone around the world. Welcome to the Institute of Public Health webinar on public health in the Arab world. My name is Ifat Al-Barazi. I am assistant professor at the Institute of Public Health at the College of Medicine and Health Sciences at the United Arab Emirates University. I'm very glad and very honored to be the moderator today for this session and for this webinar, which is, of course, going to address a very important topic. And we have a prominent and well-known speakers, Professor Iman Nouaihid and Professor Salman Rawaf, who joined us from UK and from Beirut to give us to share with us their insights and their knowledge on public health in the Arab world. Before we go further and introduce our speakers, I would like to welcome you all on behalf of Professor Michael Grivna, the director of the Institute of Public Health, and on behalf of my colleagues. This series of webinars we started this series of webinars from December, and we are so delighted that we have so many people attending these webinars and really getting the benefit of these topics that we are covering. This series of webinars is part of the global campaign, This is Public Health. And we are very proud to be affiliated with ASFER, which is the Association of Schools of Public Health in the European region. We organize these webinars monthly, usually on the third week of the month, with the aim of bringing interesting speakers and to highlight different important topics as today. In this webinar, you will be able to ask questions. We will start with Professor Iman, who will give us a talk for around 20 minutes, and then Professor Salman, another 20 minutes, and we will leave the rest of the time for questions and answers. You can use the Q&A section and to post your questions and your comments, and also you can raise your hand at the end during the discussion time if you would like to ask your question directly to our speakers. I'm very honored to introduce both speakers today, and I will start introducing Professor Iman Nouaihid. Professor Iman Nouaihid is a professor of public health at the Faculty of Health Science at the American University of Beirut, AUB, where he formerly served as a dean for 12 years, from the year 2008 to 2020. He received his MD from AUB and a Master of Public Health and DRPH in Occupational Health from the Johns Hopkins University. Professor Nouaihid is American Board Certified in Occupational Medicine and is an elected fellow to the Collegium Ramazzini since 2004. He is co-editor of the landmark book, Public Health in the Arab World, which was published in 2012 by Cambridge University Press, and he is a co-chair of the Lancet AUB Commission on Syria. Professor Nouaihid applies a social and political lens of analysis in his research, which focuses on health of workers, including working children, environment and health, and conflict and health. Under his leadership as Dean, the Faculty of Health Sciences adopted a homegrown 360-degree system network approach to public health teaching, research, practice, and policy, for which the FHS received the Global Health Leadership Award in 2018 at the Arab Health Summit organized by the Arab Community for Economic and Social Services Access in Washington, D.C. Please, Professor Iman, the floor is yours.
Thank you, Dr. Afat, and let me start by sharing the screen. Okay. Okay, can you see my screen, my presentation?
Yes, yes.
Okay.
Yes, great.
So thanks, Dr. Arafat, and thanks to the UAE University. I've spent some time years ago, like a full summer, at your at the School of Medicine there. So it's a pleasure to be here, and I will move directly into what I want to talk about. So I will quickly talk about Lebanon and the Arab world, and focus more on what can we do. And Professor Salman and myself, we did not coordinate, so I hope that we can complement each other. We've done that before several times. So just to remind you of what was happening in Lebanon, and Lebanon was center stage on media news for many, many years. So Lebanon still hosts the highest number of refugees per capita in the world. So I'm sure that you've all followed the news of the October 17 uprising or revolution. And this is an event that brought together people from all walks of life in Lebanon, from all regions, from all sects. And together they've expressed their anger at the governing powers in the country and demanded basic rights: electricity, water, transportation, food, some basic rights that have, unfortunately, we've been losing gradually over time. So the country, Lebanon, has transformed from a country hosting a crisis to a country in crisis. And so this, I think the uprising itself saw things coming. And that's why the people were angry, because they saw things coming. Currency now has been devalued by around 80 to 85%. The banks are applying extreme capital control measures. So even if you have money in the bank, you have no access to them. They give you your stipend per month. Hyperinflation is taking over, and food prices have quadrupled. The essential medicines are in shortage, so you go to pharmacies and most of the times they tell you we don't have this medicine, and we don't have even the generic. So you have to shop and go around from one to the other. Health personnel were laid off from different hospitals because of the financial crisis, and many physicians and nurses have unfortunately emigrated, at least at AUB, where they're talking about 100 physicians that left the AUB Medical Center over the last several months. Poverty rate doubled. It was 28% 2 years ago. Now it's more than 55%, and extreme poverty is close to a quarter. To add to this injury was COVID-19 that disrupted everything and practically impacted people's financial well-being and stopped businesses and closed businesses. And now August 4 came. August 4, 2020 is one of the most powerful and painful explosions in the modern history of. It happened at the port of Beirut. It killed more than 200 people, injured more than 6,000, and destroyed tens of thousands of dwellings and businesses in the areas close to, like within 3 kilometers of the blast. And what it did more than all of this, it's actually robbed every single Lebanese and resident in Lebanon of this feeling of dignity, that you feel that your dignity has been taken away with this inexplicable and ununderstood blast. The cost of the damage is estimated by the World Bank close to $8 billion. Colleagues from Faculty of Medicine and Faculty of Health Sciences at AUB conducted this study led by Dr. Joseph Khoury, a psychiatrist, and they found that 81%, this is an online survey, maybe 2,700 plus people participated, 81% reported some kind of depression, 25% are moderate to severe depression. So the whole country actually is in a state of shock and pain. We look at the Arab world. If I zoom out and think of the Arab world, I can say, and I say it with a lot of comfort and confidence, that most of the people in our region are in search of hope and dignity. And so if you look at the region, you see this map of conflicts and wars in the world, you find that our region actually has the lion's share of these wars and crises. This is more of a close-up map, and you see that different countries are either the wars are happening on their lands, or like Syria and Yemen, or neighboring countries are engaged in these wars. The AMRO, the WHO AMRO has produced a report, a recent report a few months ago, and you could see that if you look at a glance of what's happening in our region, remember 19 out of 22 EMR countries are Arab countries or in the Arab world. We have the protracted humanitarian crisis with millions of people displaced and undermined health system structures and preventable diseases, infectious diseases that are re-emerging. In 5 countries, more than 25% are below the international poverty line, and the life expectancy, although improving, is still below the global averages. This is a report that a colleague of in Morocco, Rajai Oud, developed on selected indicators on SDGs, health-related SDG indicators. And she divided the region into all oil-rich Maghreb countries, in conflict countries, and least developed with conflict too. The green means that these countries are performing best. The blue is second in line, yellow is third in line, and red is the worst. So you see here that the least developed countries are performing really bad compared to the other countries in the region, practically almost on all indicators. The in-conflict countries, it's a mix, which tells you that these countries, like Syria, like Iraq and others, they still carried through, in spite of the wars and crises, they carried through some of their achievements over the years and decades that they are losing gradually. Again, on top of this not extremely positive situation, COVID came, and we're talking about 7 million cases only 2 days ago, and 7 million out of 350 million tells you that we're not screening, we're not testing, and most probably the COVID-19 situation is much worse than what we're seeing here. And we know that there's a lot of reluctance to receive the vaccine in many countries. And of course, people who pay the price for this are mostly the less educated and poorer communities. So what can we do? I just wanted to quickly sort of remind you of what's happening in our world. But what can we do? One, I don't think we should ever give up on celebrating our gains and achievements. So regardless of what's happening around us, and it's sometimes very depressing in some of the countries and some of the sub-regions in the Arab region, but we need to be still celebrating the gains and achievements in spite of all. So the RD, our regional director, Ahmed Mandari, speaks about the increase in life expectancy, commitment to universal health coverage, but despite the complex and recurring challenges, whether it's poverty, inequity, and climate change. So people and institutions and public health people and health professionals are trying, in spite of everything, to make a dent. And I think we need to celebrate these achievements in different countries and regions. We need also to recognize and address the root causes of ill health and well-being in our region and, of course, globally. So again, the RD here talks about the triad of poverty, unhealthy lifestyles, and environmental degradation, and the poor functionality and performance of health systems. Of course, you add to this the wars, and you can get a clearer idea of what is causing ill health in the region. It's not necessarily only the health system is actually what we refer to as the social determinants. So Freudenberg, in a recent book, talks about 6 pillars of what he refers to as day-to-day life: food, transportation, education, work, social connection, and healthcare. And this is what we do every single day. We worry about our food and going around, and our education and of our children, and our work and connecting to people and all of this. And of course, receiving proper healthcare. And all of this has been worsened by the pandemic and undermined. We need to go beyond averages. So what the table I've shown you shows you the collection and groups of countries, oil rich or in conflict, but we really need to focus on individual countries and go deeper within these countries, not accept the averages. We need to see what's the difference by location, urban, rural, by gender, and by socioeconomic status. If we don't do that, there's no way our public health interventions will have an impact. We need to be focused and to intervene where things are worse. We need to adopt, number 3, we need to adopt a whole of society approach. You've heard this a lot with the SDGs, and I'm a believer that no SDG can be achieved, perhaps partially achieved, without addressing the other SDGs. They are interconnected. Poverty is related to education and gender equality, hunger to environmental issues, and so on. So we need actually to work cross sectors, cross institutions, and try to complement each other. We cannot afford that each of us works on one SDG with disregard to the other. We need to transcend health to politics. And I know that many people are very afraid and reluctant to use the P word, the politics, the political determinants, because we're getting into sort of a tough setting, and we worry about the repercussions of talking politics and trying to point fingers where we should at the political systems and the politicians too. In our region, the political determinants were still not addressed extensively, or not even addressed. We're very reluctant to talk about them. And again, going back to these 6 pillars, the day-to-day life, actually, again, taking this from Freudenberg, it's that the personal, every single one of these 6 pillars is very political. The food on the table, public transportation, what kind of education is there, job opportunities, the networking and the healthcare, they're all political. And the political is also very personal. And I think we need to keep that in mind. Just to give you the example of Lebanon, look at these indicators, and they're in green. They're practically among the top performers in the region on these indicators. They're all green, like you remember from the older table. But then we're functioning in a system, a political system that's confessional, that's sectarian, with huge mismanagement politically and economically. Corruption is all around. And so our achievements are always under threat. And what we're doing in spite of all of this could be swept out, could be undermined because of this sectarian politics in the country. Again, I want to come back to these indicators, but now look at them in a different way. So we usually try to categorize the region, oil-rich Maghreb, in conflict and least developed. But I think as a citizen, not only as a public health professional, as a citizen of this region, I have the right to ask, how come we have countries that are so wealthy next to countries that are so poor, and we still don't see this as unfair and inequitable? I think we need to look at these things and ask the question, why? I know that in public health, many people don't like to ask the question of why, but why is countries that are so wealthy looking around and even interfering in wars and politics in poorer countries and pushing them even more into poverty? We need to ask these questions. Look at the region here. I said that we're at the beginning of the Arab world, I said we're in search of hope and dignity. Look at the Arab region here. there are no countries that you could refer to as leading in the region. The leaders in this region, the regional powers that everyone talks about, are Iran, Turkey, and Israel. And we need to recognize that this is undermining the personality, our pride in who we are, and definitely getting into wars and conflicts amongst each other. I'll take this further, and you see that the different categories that we're talking about of the Gulf countries and the oil rich, and then the poorer countries and the Maghreb. Again, there is, look at geographical proximity and try to understand why is that happening. To add to this, I'm drawing this line that connects the south of Lebanon and goes through the Gulf countries, and countries below this black line here are countries that are normalizing with Israel. Countries above this line are countries that are connected to Iran. And Turkey is interfering in Syria and Libya. And again, this is going to push the region even into more instability, into more polarization. It's already polarized. And I guess we need to be very aware of this as we talk about our indicators and health achievements. They're all under threat. And then building institutions, networks, and local capacity. This is where I say it's health beyond politics. So health in spite and despite the political failures. We cannot afford but continue to work and build our institutions. We focus on SDG 3, but figure it out or think about this. If you think about SDG 16, the peace, justice, and strong institutions, you find here that we're talking about developing accountable and transparent institutions, inclusive and representative decision-making, substantially reduced corruption and bribery. Without addressing these things, we're always undermining our achievements, and our budgets and funds are going into the wrong pockets and the wrong priorities. We need to connect with each other. So thank you for this seminar, for this webinar, because people, us ourselves, I don't know how many people are participating and listening, but we need to connect and work with each other for science, for evidence, but also they might find it strange, but for solidarity and sanity. The situation in some of our countries drive us totally crazy because you have no handle of what's happening around you. Working together and supporting each other is an important step to do. And we have to think institutionally, not as individual researchers. We need to think of universities and schools of public health, programs of public health, and others talking and working with each other. We have to keep the community and people at the center of our work. They have civil demands, and their civil demands are public health demands. And we need to try to combine our work with what the people are demanding. And we have to rebuild if we have this chance of rebuilding, but think about the opportunity of building better and building with more equity and more sensitivity to things. Khadet Beirut is a group of people. Now we are like more than 150 members that got together, actually started 2 days after the blast. And as you see, the name in Arabic, Khadda, is the shake up. And we got around together to say, we cannot accept what's happening there. So we has initiated 4 initiatives, one in community health, one in education, one in environmental health, and one supporting the small and medium establishments. But in addition to our work that's connected to the community and research-driven and evidence-driven, we also have another side or another arm, which we're referring to as breaking the cycle. And so we express our political opinion, our position of what's happening around us. So we talk about breaking the cycle of corruption, breaking the cycle of disregard, breaking the cycle of mismanagement. And we try to combine what we do in public health with our voice of saying, we're not political, we're not working politics, but we're making sure that our views are well heard. Finally, it's just again that We cannot forget, please do not forget the silent, deep, and hidden wounds of people. We talk about injuries, we talk about death, we talk about diseases, but do remember that many of our injuries and wounds are really very deep. And now in the after the August 4, it's true that 200 people died, but there are families behind them. And those injured people, there are families behind them. And they will never forget what happened and how it's that impacting their stability. So these are just images of smiling kids, and it's beautiful to see a smile on their face. But again, behind that smile, there's a lot of pain and agony. And this is very common in our region. With that, I thank you for listening. Thank you.
Thank you very much, Professor Moayed. Very insightful, and thank you very much for, I think, making this, for keeping to the time and to showing us the smile of these children. I think it's indeed, this pandemic has shown us that the politics cannot be separated. Health cannot be separated from politics. And I do agree with you that such webinars help us to connect, help us to really go back to the normal life where we can really share our experiences and share our knowledge and meet people like you. Thank you very much. I would like to introduce Professor Salman now, again, a very prominent, well-known public health professional, academic and researcher. And I'm really very honored to, again, to introduce Professor Salman. Professor Salman Rawaf is the chair of public health, director of WHO Collaborating Center in the Department of Primary Care and Public Health at the Imperial College London, UK. He acquired his qualifications in medicine with training in pediatrics and public health, and spent the breadth of his career in leading roles in the NHS. Professor Rawaf is a globally recognized professional and academic for his international work and contribution to global public health, health system development, primary care, and medical education and research and service delivery. He's an advisor of the World Health Organization on primary care, public health, health systems, medical education and training, human resource for health, and COVID-19. He is involved in many national and international advisory works, including different task forces on COVID-19, and is a member of a number of editorial boards. Professor Rawaf published almost 250 scientific papers, 5 books, many international reports, and received many awards and recognitions, including the Life Achievement Award for innovative works in shaping health services, research, and medical education in 2015. Please, the floor is yours, Professor Salman. You can share your screen.
Good afternoon, good evening, good morning, everyone. Thank you very much, Dr. Arafat, for the introduction. I think the video is blocked from your side. Anyway, I'll try to load my slides, and I hope you can see it now.
Yes, we can see it. Ismail, can we fix the issue with the video, please?
Yeah, no problem. I thank my dearest brother and friend, which I really admire, Iman, for his excellent presentation. And I totally agree with the point he raised. And one of the most important points to me, the highlight, is actually what happened in Lebanon. Sadly, something could happen in any Arab country, and we need to be aware of that. Some people may say, yes, it's easy to say that while you are actually sitting in the heart of London, but my heart, my thinking, and my involvement day to day is in the Arab world. I'll try to avoid clashing with some of the point or overlapping, not clashing. I will never clash with Iman at any cost. Overlapping some of the point. I agree with Iman that we have to celebrate achievement. There are a lot of achievement happening in the Arab world, covering about under 400 million population, representing about 5% of the world population. majority of them under the age of 26, that represent over 50%. And with rapid population growth, I think this is really very interesting point, because that affecting the both the burden of disease, as you will see in a minute or two, but also the interactive between communities, and even maybe a source of conflict, as some people may think. And I think there are plenty of resources, huge potential, which need to be tapped on in terms of agriculture, fishing, etc. Yes, we have major issues with the water, but the worst things, as Iman mentioned, is the conflict and civil unrest, which exist in about 11, 12 countries. And when we talk, I mean, this is a description of the Arab world. When we talk about achievement, I don't want to go through this. I'm just giving you a list. This is, to me, a list of achievement. I always feel proud of it, and we highlighted these within the Arab Public Health Association, to whom I have the honor and the privilege being the current president. But we documented that in the association annual report. So I don't want to spend more time on it, but we have to celebrate it. Let me look at certain diseases which are affecting our region in such negative way. And if we look at the total mortality, despite the increase in life expectancy, by the way, Lebanon was, before the crisis, recent crisis, was the highest life expectancy in the Arab world, followed by the GCC countries and other countries. They managed to move their life expectancy. While there's a sharp decrease in life expectancy in the three countries which are in conflict, Iraq, Syria, Iraq, and Yemen, unfortunately. But if we look here, that most of the mortality coming from the blue things, and the blue things here is basically, we are talking about really coronary heart diseases, and this is neoplasm, whether related to the metabolic disorder, all the risk factor, which is well known, or attributed to behavioral risk factor, or indeed the environment, which Iman touched on. When we come to the disability and the daily, for all ages I'm talking here, and we will see that when we look at behavioral things, this is now leading, that actually still cardiovascular diseases are very important. But also we see here issues related to infection, nutritional deficiencies, and maternal and neonatal issues. I mean, these are actually mainly in the low and middle income countries, but certainly we see an increase this in the high income countries, which is mainly the 6 GCC, indeed even upper high middle income countries, which we have seen some increase, unfortunately. And this is contrary to what happened around the world. We've seen major reduction in cardiovascular diseases, simply because of the prevention agenda, number one. And secondly, the quality of the health services we received, and in particular, the early intervention. We have the technology actually to reduce that amount of disease burden. That was in general. I looked at it here in terms of the specific countries. And we included here some of the IMRO countries like Iran and other countries. And we see again, both in male and female, almost all the countries, they have problem with the issue of cardiovascular diseases, and the dark one is cancer. But also at the same time, if you look at the green one here, this is Yemen, this is Iraq, and this is Syria, and especially among male. Many lives are lost, and we are losing many lives because of the conflict. And of course, Palestine, our beloved Palestine, we shouldn't forget about that. So these four countries, their people, in particular male people, suffer. But this is not exclusive. In Syria, both male and female are suffered. So is the case in Iraq. So is the case in Palestine, in Yemen, but relatively speaking, young men are lost in these sort of conflict. And again, this is now presenting the data in slightly different format. It's the same data, just to emphasize the burden of disease and how public health priorities should be shaped in the future. Look again, at most of the countries, they have cardiovascular diseases number one. When you prioritize these diseases, you find number one cardiovascular diseases. But at the same time, when we look number one here in Djibouti, we look number one here in Yemen, it become really women and children, newly born children health, When we look at the pressure of, for example, mental disorder, I don't know why Qatar is high on that, but it is high. And when we look at Bahrain, which is a lovely place, you will find diabetes and kidney failure, chronic kidney diseases are seen as number one. This is a very serious picture which need to be taken in consideration by the policymaker. Public health is about politics, as Iman said, and I would say that if public health specialists don't talk about the politics of their countries, they are not in public health. They need to find another job, And this is the same picture about death. I don't want to go through it, just show it to you, explain what's happening. If you look how many people we lost in collective way over 10 years, I don't have the recent data. And thank you, Celine, for all this analysis over such a short period of time, if you are listening to me. I'm grateful to Celine Tabash, our PhD student at Imperial. And if you look in collective 10 years and link it to the population growth, link it to the change in disease pattern, etc., this is the key is here. You see the most important factor in losing life is collective violence and legal intervention. The term legal intervention means a declared war. And you can see what's happening today in Syria, in Iraq, in Yemen, in Libya. It's really unacceptable. I mean, a situation which is all of us, not a single Arab, wherever he or she is, accept that and not rejecting it. Let me focus on health system a little bit. I just want to spend 1 or 2 minutes mainly on finance, because the issues of health system is very complex. But I think people can unfold a variety of things when we look at how health systems are financed and how health systems are operating. And this is the most up-to-date data from Awad Mataria, to whom I'm really very grateful. We produced a beautiful atlas in 2018 summarizing all finance in these countries. Of course, IMRO included Afghanistan, Islamic Republic of Iran, as well as Pakistan. And you will see that all the countries, with the exception, I don't know how the figure is coming from Afghanistan, but if you look at the Arab countries, most of them, they don't spend the level which is expected, like the European countries of 9%, because we see, that government, in particular government share, when you look at government share of that expenditure, is really, really very low. On average, it's about 2.5%. Yes, the total health expenditure may go up to 6 and 7, but mainly from the out pocket of the individuals. And out of pocket is really extremely high. You look at Yemen, it's something like around reaching about 80%. It's only the Gulf state, actually you see it below 20%, but on average, it's really relatively high. And with the level of poverty mentioned by Imam, and even the level of extreme poverty, it's really unacceptable. And this is a welcoming politic that we should intervene. And if we look at the data in terms of how much Arab countries spend collectively on education, health, and indeed social protection, is below 11% of their national budget. And I looked at the figure this morning, how much we spend in the United Kingdom on these three things alone is about 3/4 of the budget, which goes into billions and billions. And when Aisha Hamid from Qatar, when this is part of her PhD, which she finished at the end of last year, and when she looked at selected IMRO countries and correlated between per capita spending and the quality and access to healthcare, obviously the more you spend, the more the access and the quality actually increase. And this is a beautiful slide, summarize it. I'll touch on the environment. Actually, Iman mentioned it in a beautiful way. I don't want to spend much time on it, and I want to look at it. This is the list. And for each one, we could talk for a whole day. Environmental issues are actually serious issue in the Arab world. And by the way, I denounce my colleague, Professor Blair in Al Ain, for his article refusing the name of the Arab world. We say to him here and openly, the Arab world do exist, and that term is very important. He may not have the capacity to absorb it, but we do, all of us, and we are proud of this. So if we look at the environment, it really, that is almost the weakest link between burden disease and the effect of environment on the diseases which we are suffering from. All need to be addressed. I don't want to spend more time on this, but it is not only the role of the government in the Arab world. It is the role of the citizen too. Unless citizens take responsibility in looking at the environment and protect the environment in which they live, we will not succeed. Secondly, public health specialist practitioners, they need to be aware of assessing the impact of these environmental factors. And unfortunately, we found across the Arab world and all the countries we visited and we discussed it, and from our various discussions through the Arab Public Health Association, this is weakness in the skill of the people who are practicing public health in our region. And I come to this point in a second. Look at this fantastic citizen, a photo which I took in Amman. This is one of the posh area in Amman, a lovely place. And by the way, there is a big hotel on the right side, big hotel on the left side. Because I own a Mercedes, I can't park it anywhere. No respect to the citizen. I have worse photograph than this, but I didn't want to share it today. This is a respectable photograph. But if the government accept, if the citizen accept the abuse, and this is not only abuse for my freedom as a citizen using the pavement, but also abuse to the newly laid pavement by the government and the huge expenditure to achieve that level of payment. And you see it everywhere in the Arab world. This is no exception. I want to focus here on the public health workforce. Unfortunately, we've been working very hard, my team and colleagues across the Arab world through the Arab Public Health Association, to find actual data on public health personnel at all levels. I'll come to the levels in a minute. But we could not obtain the data. WHO, they have very helpful website, but this is simply about health workforce in general. There is nothing specific or definition of public health workforce. And the recent project, 2020, working with colleagues at CDC in Saudi Arabia, I'm very pleased recently they changed it into Public Health Agency, Public Health Authority just a couple of weeks ago, which is fantastic news. And we hope that every country will have a public health agency dedicated for public health. And we need to move away from the term community medicine as soon as possible. Data was collected in the Saudi Arabia, and we found actually, despite a huge investment, there are huge shortages in public health. And COVID-19 taught us a lot about the skills, the gap, and the competencies in public health. Samer Jabbour and another colleague written recently document in terms of what happened in the Arab world during COVID, and highlighted a lot of points which need to be addressed and need to be aware. Almost all linked to the weakness of public health workforce in the region. And generally speaking, and this is also appeared in the book, which actually Professor Iman mentioned, Public Health in the Arab World. And at that time, I written that this is about a few years ago, and now this classification is almost international. We are talking about a three type of workforce: the wider public health workforce, which is a lot of people we have involved in public health, but they don't have public health qualification, whether they come from social worker, they come from nursing, they come variety of workforce. And they represent about 70 to 80% of the people delivering public health services, yet they don't have proper training, proper qualification. We have a large number of people, of practitioners of public health, majority of them MPHs, but many or reasonable size, they have PhDs, but they were actually not exposed to structured training addressing the competencies needed for public health. Yet very small percentage at consultant level in some countries called specialists are fully trained. This is about 4 or 5 years training in the field, reaching to the board level or the fellowship of colleges across Europe. These are very small. And unfortunately, even in our Arab countries, we have these 2% in some countries, but they are not engaged in public health. They are actually moved into managerial posts or businesses, and their expertise almost died, unfortunately, despite the fact they are licensed as consultant in public health. I mean, this is a very big issue which we need to address together in collaborative way, in working together and exposing ourselves and others to the ideas in terms of how should we really change this workforce, train them, equip them, make them able to deliver effective public health to the population they need. And when we link these 3 levels to the competencies required, but they may be competent to the level that they deliver public health, but not to the expert or proficient level. I mean, those level 2 They know very much a lot of public health, but when become the finest skill, they are not there. It's the art of moving these two groups actually into level 1 or nearer to level 1. I mean, it's mission impossible to make everyone with level 1 and very costly and time consuming. And therefore, we are aware of the shortage at all levels. We know that those fully trained mainly come from the medical side. Unfortunately, public health is multidisciplinary, and we must recognize that. The Arab Board for Community Medicine should change tomorrow into the Arab Board for Public Health and open it into a multidisciplinary. We need to define, and as I said, for the Saudi project now, we are hopefully publish it soon, define the competencies at each level and how to raise the competencies part of the career development. But if I want to develop my career and there is no structure in my country, where I go after that? And that is what is missing almost in most of the countries. There is no defined structure that I know if I'm promoted, if I actually progress myself, I could fit in that role very soon. And if I mention the role of academia, I will start weeping, but I think I just want to say 2 or 3 sentences. We've seen in the Arab world the role of academia during the pandemic. I don't want to use negative adjective, but I hope they have the gut and the soul to review that role, where should be sharp and to the point in addressing that pandemic, which has touched every single human being around the world, not only today, but actually for many years to come. If you look at the people, because of the lack of training, when they looked at the pandemic, and I want to spend a minute or 2 here, is really they look at it, this coronavirus is an infectious disease. And I recall a meeting with Ahmed al-Mundari and many other colleagues at WHO, the sentence which was used, this is a new virus with a new dynamic. People, they just focus that this is respiratory disease. It's not. This is precisely the same mistake in 1982 with HIV. HIV is an infectious disease affecting the immune body of the system. We discovered later on, yes, but it is a chronic disease. It's for life. So far with long COVID, and what we understand now about a year from the pandemic, at least in the UK, we know the high percentage of the people who are infected with COVID, whether mild, moderate, severe, or critical, actually finish with a long-term condition. Although some of them, they don't know. It's simply about 2-3 months, they went to the hospital because of the increase in blood pressure, because of the tinnitus in the ear, because of neuropathies. But in reality, when you dissect in the history, all of it linked to COVID-19 and the virus. Public perception about public health, how to actually improve our image, not only improving the role of academia, but also among the public to improve our image. A lot of work is needed. You mentioned it, sir, Professor Nouaid, beautifully, that war and a crisis, I'm just repeating your map in different format, and displaced people, not only in Lebanon, yes, per capita, they have the highest, but it is everywhere. It's not only that. The blue one is everywhere around the world now. We lost, millions of people could contribute to the economy, to the education, the culture of the Arab world. Those who left tend to be the most educated, the most able, the most entrepreneurial in nature, etc. That is a loss to the region. That is unacceptable loss. And who is responsible for it? We don't have the courage. We lack the courage to say who, and we should have it. And you look at poverty, I'm glad it's already mentioned. And I, by the way, redefine poverty from various studies. I disagree totally with the World Bank, and I did have various meetings with them when they talk about $3 a day, etc. And I said to them, you know, all those employed in the World Bank in our discussion, I said, I give you $20 a day, and I want you to live as a human being, you know. Every one of you taking a salary of 200, 300,000 a year, and you're talking about poverty. We're talking about here 500, and that's the definition. And look at it everywhere. Illegal settlement, people living in unbelievable conditions around our region. Why should we accept that? Why should we live in beautiful houses and allowing people to live in such poverty? The very last two slides is tomorrow's driver. And I think the aging population didn't touch us. I mean, if you look at the data from Sweden today showing that how public health in Sweden, you know, almost now accused being deliberately killed the elderly population in nursing homes because they didn't take the right measure, especially the locking of town and cities. Almost reached the level of accusation direct. But we should celebrate aging population, and the people who are aging, you know, in any society is a credit to that society, is a credit to the social system, is a credit to the political system, is a credit to the health system. And population growth is strength, not weakness. Why China seeing population, you know, of 1.4, 0.5 billion is a plus, and Egypt see it very difficult that having a 100 million population is a negative things. This is where the ability of people in public health to manage population, to advise on how to use these beautiful resources, the resources of a human being, in positive way. You know, there is not a single one who is not clever, not able, etc. It's the failure of our political system to use the people in the right way for the right purposes. We are facing, you know, advances in technology which is never seen before in the history of humanity. All of it to serve humanity. Yes, it may be used in a negative way by some wicked people, but the technology is making life faster, easier. We are actually living more comfortably with technology and solving a lot of our problems. And we were looking at, for example, artificial intelligence and how that will help solving a lot of the issues, health, social, economical, you know, for better health, well-being of a human being and prosperity. I think the way forward, I finished. The way forward is actually, Iman mentioned it, I don't want to repeat it, is about, I think one thing he alluded to it, which is really stability and security. Need to add it to the 6 pillars, 6 essential. And the public health workforce, I mentioned it. We need to strengthen the law to protect the environment and people health. We've seen how in this pandemic, the law couldn't be enforced in many countries. And health cannot be taken away from housing, education. We have to feed ourselves. We have to protect the environment through better forest. And the evil which we are facing now is the issues of privatization, not only in health, but all our institutions now exposed, and this is come under tremendous pressure from United States and some Western countries, privatize. This is, in my opinion, and the data which is available is a big mistake. Women should play a full role in society. Society without them is absolutely meaningless. And in health system, primary care, without primary care, there is no health system, and primary care should be 100% the state responsibility, not a private sector at all. And introduce and invest. Yes, private sector could provide it, but commissioned by the state. Healthy childhood, they are the future. Because again, one of my colleagues saying, look, locking down town and cities was a mistake in the Arab world. No, he's wrong. And the justification he put was because the majority of the population are young people. He's wrong. The young people are suffering a lot from COVID in many countries in the world, and they are the next generation. They should be given the priority they deserve. And last but not least is the economic development. With this flower from my garden, I thank you very much indeed.
Thank you very much indeed. I think I really enjoyed it, and I don't want you to stop, but I'm so sorry the time is running quickly, and we already reached 8 o'clock. But if
24 minutes, I'm sorry, Dan, 24 minutes, sorry.
Sorry, but with your permission and Professor Iman's permission, can we extend another maybe 5 to 10 minutes and take some questions from the audience? Is it okay?
Welcome.
Yeah, so we have a couple of few questions from the audience, and I believe someone wanted also to ask a direct question. Would you, Ismail, give him please the permission to open his mic?
Hello?
Yes.
Yes, I just thank you for this organizing this wonderful presentations. I enjoyed them, both of them. Thank you for Professor Iman and Professor. Hello?
Yes, we can hear you. Professor Iman and Professor Salman, yes.
Yeah, Professor Salman. So I mean, Professor Iman has beautifully highlighted how the political situation is very interconnected with the health, and as you said, Mrs. Presenter. But I think he has perhaps forgotten that the role of the Western countries in interfering in various political affairs is one of the key factors which nobody has mentioned at all. And I think that ought to be taken into account. And I thank Professor Salman for mentioning the training for public health. It's very much needed. And I think, I hope he can make a change and introduce it in some of the Arab countries. Thank you.
Thank you very much, Dr. Jawad. Maybe before we give the floor to Dr. Iman, Professor Iman, to answer you, also there is a question from the audience on can one estimate the cost of the loss of expertise of workforce due to conflict and lack of opportunities? Maybe then Professor Salman can highlight this area again. Please, Professor Iman, do you want to start?
Yeah, Dr. Jawad, I 100% agree with you. So maybe in a future presentation we should show that up with just the map that it stopped there. But you're right, because the foreign interventions are regional, but then beyond these regional powers, there are the other forces that are powers that are interfering, whether it's the US or Russia and others in so many different ways. So thanks for bringing that to my attention. And you're right. We should always present the fuller picture there.
Thank you, sir. Thank you.
Dr. Jawad, marhaba. How are you?
Hello, Doctor. Hello, fine. How are you? Good to see you.
Good to see you. Lovely to see you, Jawad. I think I mentioned under privatization, and I was rushing to finish the presentation, which was really longer than expected by a few minutes. But to be very honest with you, I mentioned United States and Europe and the pressure they put on our political system. And I use the example of privatization, but also the interference in politics, the war, the illegal war. You have illegal forces, because somebody naively, sometimes they say, oh, it's only the regime in Syria responsible for what happened. Of course they do. And of course they should take prime responsibility. But at the same time, I put my forces there occupying oil field, or Turkey, as Iman mentioned, invading part of the same things in Iraq. You know, today there are forces, Turkish forces in northern Iraq in more than one site, and so on and so forth. Occupation of Iraq, the things happening in Yemen, and many other. Libya is a very good demonstration where all the West agreed and landed there, and they are still there until today. So again, Turkey mentioned already. So yes, that interference is there, and we should in public health have the courage, the full courage, to mention it, to research it, and show it to our masters, the politician, and with all respect and in delicate way, that these are problems need to be addressed. And if you have the courage, please address it. And I have no doubt that our politicians have the courage, but they need the support of the people. You know, the people need to be with them. When the intellectual people, like public health people, actually providing the data, the instrument, politicians will not be afraid to talk about it.
Thank you very much.
Thank you so much. Thank you.
Thank you. Yes, please.
Sorry, the other question that Jawad posed was the cost of the loss of
yes. Sorry.
Yes. I think you know about Iraq, and we know about Syria, and the depletion of the human resources in health and otherwise. It's estimated that more than 70-80% of Syrian doctors have left, and I know in Iraq that many also have left. So wars and conflicts push people out, and that's a big loss. Whether we can put a dollar figure on that, it's not an easy thing, but countries invest in those people, and then when they're ready to give back, they're taken away. So it's the brain drain that we always lived with, but this is actually an extenuated one with the conflicts and war.
Thank you, sir. Very kind.
But Iman is combination of, it's not only, you see, I'm one of those people who left, not because of war or conflict, you know. Actually, I'm a victim of brain drain, you know, because the environment which is created for us, and the seduction, put it this way, for people to join workforces outside our region is really unacceptable, you know, for everyone. All of us regret it. I mean, yes, at this age, maybe we are regretting it, that we are not in the region. As I said, our heart and soul is in the region. But I think we need to look, as I said, is do we have the security? Do we have the infrastructure? Do we have the environment in which we can thrive and do the things which we can do it? I'm sure if I was in any other Arab countries, I may have limited freedom to talk in the way I'm talking today, and I was talking yesterday, and I will talk in the future.
I think there is a question, actually a comment from one of the audience, Professor Munir Marhaba, that employment is something to be considered. I think, and this brings us back to the public health professionals and the employment of public health professionals, and of course licensing and accreditation of the public health profession. I think we can just finish our session here, unless if you have any more comments. I have to apologize from the rest of the audience and the participants for the questions, but we are already ahead of time. Do you want to say anything, Professor Iman, before we end, and Professor Salman?
I'm skimming through the questions and answers, and all I have to say, this confirms my deep belief that we're in this together.
Yes.
We're in this together. We, none of us as institutions, none of us as individuals can do it alone. We have to trespass. We have to transcend geography, our imposed political borders and political divisions, and try to work together. I think there are more things that bring us together than things that separate us. And as public health professionals, we need to invest in that. But then, as Salman repeated several times, we have the courage to point to the root causes of these problems and the fact that it's our right to demand good governance. It's our right as citizens. This is and the right to express ourselves and to be part of decision making, and not as public health, as citizens, I'm saying. Thank you so much.
Great to end with this. Professor Salman, yes.
I thank you very much, Dr. Arafat. I fully agree, and I think we have to work in collective way as a single voice, addressing not one or two limited issues. We have to address the wider public health agenda and the big challenges the region is facing. But to do so, we need a strong public health workforce. We need a strong infrastructure. We need also academia who are capable of supporting us in the services, because the service need strong academic people. If that don't exist, that balance, then you will have problem and people worry about their career. What is the point in studying public health, which then I don't know where I'm going to finish. We have some lovely people in public health in the Arab world, and we need to treat them as treasure.
Great, I think, words, and I do second everything you said, Professor Iman, Professor Salman, and I really look forward to see myself more collaboration, more networking between us in the Arab world and the people who migrated like you and me and everyone who migrated and left our countries to join forces, maybe to work together to improve this the public health in the region. With this, I would like to end this session. I would like to thank you, Professor Iman, Professor Salman, for your valuable time, for your valuable thoughts and provoking, actually thought-provoking presentation. And I do really thank you. I look forward to have more of this discussion, either through webinars or through conferences or through different platforms. I invite everyone to be part of these webinars that we are organizing. I would like to thank everyone who made this webinar happen and take place. I would like to thank, of course, our participants, our audience, our speakers, the management at the UAE University, at the College of UAE University, and Professor Michael Grivna, our organizational team, Mr. Ismail Kunaisi, Mr. Asajar, Ms. Shams Al-Shamsi, and all our faculty members in the IPH and our students who are always supporting us, and they are always behind us and motivating us. Thank you all. I would like to remind everyone that our next webinar is going to be on the 20th of April, and I hope we will have again very interesting speakers and very prominent speakers. You can follow us also on our social media, and remember that this session and the previous sessions are recorded and will be uploaded soon on YouTube. We will be sharing the YouTube channel link for everyone who would like to attend this webinar and the previous webinars. Thank you very much, and I look forward to see you all in good health. Stay safe and stay healthy.
Thank you. Bye-bye, Iman.
Bye-bye, Salman. Good to see you.
Thank you very much.